actually, as I said, because GBA is so common, there's such an impressive, effort towards the specific treatments. And, because usually the problem with genetic disorders is that they're really rare. And because they're rare, there is not so much interest, like from companies to develop specific drugs that, may save life, but only to a very small minority of patients. Well, in this case, even being a genetic disorder, it would affect such an important proportion of PD patients that there's really a lot of efforts. So, I mean, clearly, precision medicine means that, if I know that the patient has got a GBA variant and this patient has PD, the idea is just not to treat him like with common drugs that are used to every PD patient, but just to be able to use drugs that can specifically tackle the, molecular pathway that is in which GBA is involved, and try to act on that. So, for instance, either by increasing the levels of GBA enzyme or by, improving the transport of the GBA protein to the lysosomes, because certain mutations totally abolish, of course, the production of GBA protein, which means that we just have less GBA. For instance, if we have a truncating mutation, or many of the severe one, or many of the rearrangements are like that, this allele, this copy of the gene, does not produce a functional GBA. So in that case, what we need to do is just to try and enhance the production of the enzyme. But in other cases, other missense variants, maybe we do produce, the mutated gene produces the protein, but this mutated protein is not functional enough, activity is reduced, or maybe it cannot properly move to the lysosome, that is the site where the enzyme needs to act. So attempts are, using chaperone proteins to enhance this transport, or maybe just, enhance the activity of the GBA, and so on. So there are really many trials going on. And many of them are really in a relatively advanced stage, and we'll see some good results in the hopefully in the near future about that.